This video is going to be about the axilla. So, the axilla acts as the primary passageway between the neck to the upper limb. It serves as a transition zone through which nearly all major nerves, arteries, veins, and lymphatic channels supplying the upper limb must pass. So, structurally, it resembles an irregular pyramid formed by a combination of bones and muscles, notably the clavicle, scapula, upper ribs and thoracic wall, and the proximal humerus. So it is anatomically described as having four walls, which is your anterior, posterior, medial, and lateral. An inlet, which is the apex at its superior end. A floor, the base at its inferior end. The axillary inlet communicates with the lower part of the neck, and the floor opens laterally into the arm. Additionally, muscular spaces between the anterior and posterior walls create openings through which nerves and vessels connect the axilla with the deltoid, pectoral, and scapular regions. So, the inlet of the axilla, also called the apex, is directed laterally and lies in a horizontal plane when the arm is in its anatomical position. It is triangular in shape. Now, let us understand the boundaries of the axillary inlet. So, medially, it is the lateral border of the first rib. Anteriorly, the posterior surface of the clavicle. Posteriorly, the superior border of the scapula extending up to the coracoid process. And the apex, which is located laterally, formed by the medial aspect of the coracoid process. All major neurovascular structures supplying the upper limb pass through this inlet. The subclavian artery becomes the axillary artery as it crosses the lateral margin of the first rib to enter the axilla. The axillary vein becomes a subclavian vein when it crosses the same margin in the opposite direction. At the inlet, the vessels and nerves lie in a specific anterior-posterior arrangement. Vein is most anterior, followed by artery, followed by the trunks of brachial plexus, which is the most posterior. We can remember it by VAN, which is vein, artery, nerve, anterior to posterior. The inferior trunk of the brachial plexus, as well as the subclavian vessels, lie directly against the superior surface of the first rib. The anterior scalene muscle inserts between the vein and the artery at this point, separating them. Next, coming on to the anterior wall of the axilla, which is formed primarily by the pectoralis major, pectoralis minor, subclavis, and the clavipectoral fascia. The anterior axillary fold corresponds to the lower border of pectoralis major. Now let us understand these muscles in detail, its origin, insertion, nerve supply, and action. Pectoralis major is the most superficial and largest muscle forming the anterior wall. It has two primary heads, the clavicular head and the sternocostal head from which it originates. The clavicular head arises from the anterior surface of the medial half of the clavicle. The sternocostal head arises from the anterior surface of the sternum, the first to seventh costal cartilages, the sternal end of the sixth rib, and often has additional fibers extending inferiorly to blend with the aponeurosis of the external oblique muscle, forming an abdominal extension of the muscle. Now, all the fibers converge to attach to the lateral lip of the intertubercular sulcus of the humerus. A key anatomical concept is that the fibers that originate higher on the trunk attach lower and more anteriorly on the humerus, while those originating lower attach more superiorly. Now, the actions of this muscle are to flex, adduct, and medially rotate the arm at the shoulder joint. The clavicular head assists with flexing the arm from an extended position, while the sternocostal head helps in extending the arm back from a flexed position, especially against resistance. Now, it is supplied by both the lateral pectoral nerve and the medial pectoral nerve. Next, coming on to the pectoralis minor muscle, which is a small triangular muscle deep to pectoralis major. It originates as three muscular slips from the anterior surface and upper margins of ribs 3 to 5, as well as from the deep fascia overlying the intercostal spaces, and inserts onto the medial border and upper surface of the coracoid process of scapula. It draws the scapula forward, that is protraction, depresses the lateral angle of the scapula, and stabilizes the scapula against the thoracic wall. This is supplied by the medial pectoral nerve, which pierces the muscle to reach the pectoralis major. Next, moving on to subclavius, which is a small cylindrical muscle deep to pectoralis major. It arises from the junction of the first rib and its costal cartilage, runs laterally and slightly superiorly, and attaches to a long, shallow groove on the inferior surface of the middle third of the clavicle. Although its exact role is debated, it likely depresses the clavicle, stabilizes the sternoclavicle joint, and resists excessive elevation or medial displacement of the clavicle. It is supplied by the nerve to subclavius originating from the upper trunk of brachial plexus. Now, finally, coming on to the clavipectoral fascia, which is a strong sheet of connective tissue that spans the area between the clavicle and the floor of the axilla. It encloses both subclavius and pectoralis minor muscle, provides a protective barrier around the vessels and nerves, allows structures to pass through it to move between the axilla and the anterior chest wall. Coming to the structures passing through it, we have one vein, one artery, and one nerve, which is the cephalic vein, thoracoacromial artery and its pectoral branch, and lateral pectoral nerve. Below pectoralis minor, the fascia allows passage of lateral thoracic artery, and the medial pectoral nerve pierces the pectoralis minor itself. Next, coming on to the medial wall of the axilla, which is composed of the upper thoracic wall, the upper ribs and intercostal musculature, and the serratus anterior muscle. So the serratus anterior muscle arises from the lateral surfaces of ribs 1 to 9, including the deep fascia overlying the intercostal spaces, and attaches along the entire costal surface of the medial border of the scapula. It helps in protraction of the scapula. It is essential for upward rotation during overhead abduction and holds the scapula firmly against the thoracic wall. It is innervated by the long thoracic nerve running on its external surface. Clinical significance is that the damage to this nerve, commonly from trauma or surgery, results in the scapula protruding backward when the patient pushes against a wall, which is winging of the scapula. Now, coming on to the lateral wall of the axilla, which is the narrowest of all the axillary boundaries, it is formed entirely by the intertubercular sulcus of the humerus. So, the muscle attachments along the sulcus, three major muscles attach around this groove. The pectoralis major, which inserts on the lateral lip of the intertubercular sulcus, latissimus dorsi, which inserts onto the floor of the sulcus, and teres major, which inserts onto the medial lip of the sulcus. So, lady between two majors. These attachments collectively define the spiral muscular convergence that helps guide the humerus during rotation and adduction. Next, coming on to the posterior wall of the axilla, the posterior wall is complex, containing a combination of bone and several major muscles. So, the bony component is the costal or the anterior surface of the scapula, which forms the deep foundation of this wall. The muscular components are the subscapularis, which occupies the entire subscapular fossa, latissimus dorsi, which contributes its tendon to the lower part of the wall, teres major, which lies just superior to latissimus dorsi, and long head of triceps brachii, which descends vertically along this wall, forming boundaries of important spaces. These muscles together create the posterior axillary fold, which corresponds externally to the lower border of latissimus dorsi and teres major. Since I've covered these muscles as well as the posterior scapular spaces in other videos, I will not be covering that in detail. Next, coming on to the floor of the axilla. The floor forms the inferior base of the axilla and consists of the skin of the armpit and the superficial as well as the deep fascia. The deep fascia here is supported by the clavipectoral fascia. Externally, the anterior axillary fold, which corresponds to the pectoralis major, is positioned higher than the posterior axillary fold, which corresponds to latissimus dorsi and teres major. Now, lateral to the floor, the anterior and posterior walls converge, forming the entrance into the anterior compartment of the arm, through which major neurovascular bundles pass. So now coming on to the contents of the axilla, which consists of the axillary artery and its branches, axillary vein and tributaries, brachial plexus cords and branches, the lymphatics, fat connective tissue, and the proximal portions of biceps brachii as well as coracobrachialis, along with the axillary extension of the mammary gland. Now, the details on the biceps brachii and coracobrachialis will be covered in the next video. So, coming on to the axillary artery is the major arterial trunk supplying the entire upper limb. It begins at the lateral border of the first rib, where the subclavian artery continues into the axilla and takes on the name of the axillary artery. After coursing through the axilla, it ends at the inferior border of the teres major muscle, where it becomes the brachial artery. A key landmark which divides this artery into three parts is the pectoralis minor muscle, which crosses the artery anteriorly. So it's divided into three parts. The first part is located proximal or medial to the pectoralis minor. Second part lies deep to pectoralis minor, and the third part is located distal to pectoralis minor. The artery typically gives rise to 6 branches, 1 branch from the first part, 2 branches from the second part, and 3 branches from the third part. A branch of the first part is the superior thoracic artery, which is a small artery arising from the anterior surface of the first part, supplies the upper portion of the medial and anterior walls of axilla, including the first and the second intercostal spaces and adjacent musculature. The second part gives rise to thoracoacromial artery as well as the lateral thoracic artery. Now, the thoracoacromial artery originates from the anterior surface of the second part of axilla, just posterior to the superior margin of pectoralis minor, curves around the upper border of pectoralis minor, pierces the clavipectoral fascia, and divides almost immediately into 4 branches, which are your pectoral branch, deltoid branch, clavicular branch, and acromial branch. Next, the lateral thoracic artery, which is again a branch of the second part, arises again from the anterior surface of the second part, posterior to the inferior margin of pectoralis minor, descends along the side of the thoracic wall and supplies your serratus anterior pectoralis muscles and the axillary lymph nodes. Now, the third part of the axillary artery gives rise to the subscapular artery, the anterior circumflex humeral artery, as well as the posterior circumflex humeral artery. The subscapular artery is the largest branch of the entire axillary artery and the primary arterial supply to the posterior axillary wall. Now, this arises from the posterior surface of the third part and divides into its 2 major terminal branches, which is the circumflex scapular artery, which, if you remember from the previous video, passes through the triangular space, reaches the infraspinous fossa, and supplies the posterior scapular region, forms part of the scapular arterial anastomosis with the suprascapular artery and the dorsal scapular artery. Now, the thoracodorsal artery runs downwards along the lateral border of the scapula, continues to the inferior angle, and supplies the latissimus dorsi, parts of serratus anterior, and subscapularis. Coming on to the anterior circumflex humeral artery, which originates from the lateral aspect of the third part, passes anterior to the surgical neck of the humerus and anastomosis with the posterior circumflex humeral artery, which arises posterior to the anterior circumflex branch and passes through the quadrangular space with the axillary nerve, winds around the surgical neck of humerus, and supplies your deltoid, teres minor, long head of triceps, glenohumeral joint, and the surrounding soft tissues. Next, moving on to the axillary vein, which begins at the inferior border of teres major, where it is the continuation of basilic vein. It travels superiorly through the axilla, lies anterior and medial to the axillary artery, becomes the subclavian vein at the lateral border of the first rib. Most of its tributaries correspond to branches of the axillary artery, which is the superior thoracic vein, thoracoacromial vein, lateral thoracic vein, subscapular vein, and circumflex humeral veins, the anterior and posterior. Additionally, it also receives brachial veins following the brachial artery, cephalic vein, which enters through the clavipectoral triangle after piercing the clavipectoral fascia. The brachial plexus will be covered in a separate video. So next, moving on to the lymphatics of the axilla, it receives lymph from the upper limb, which ultimately drains into the axillary lymph nodes, and a major portion of the drainage from the thoracic wall, back, anterior chest, upper abdominal wall, and breast also enters the axilla. There are typically 20 to 30 lymph nodes within the axilla, which are classified into 5 groups based on their precise anatomical location and the regions they drain. The 5 axillary lymph node groups are: 1, your lateral or the humeral nodes, which receive the majority of lymphatic drainage from the upper limb. Next, the pectoral or the anterior group of nodes, which receive lymph from the anterior chest wall, the upper part of the anterior abdominal wall, and large portions of the mammary gland, particularly the lateral and inferior parts of the breast. The subscapular group of nodes, which is the posterior group. They lie along the posterior axillary fold and they drain the posterior shoulder region, the upper back, the posterior thoracic wall. The central nodes, which are embedded deep within the axillary fat. So they do not directly receive lymph from body surfaces. Instead, they collect lymph from all the other three groups, which is the humeral, pectoral, and the subscapular. And the apical nodes, which are the highest group in the axilla, located at the apex near the axillary inlet alongside the vein and associated vessels. So they receive lymph from all the other node groups, lymphatics accompanying the cephalic vein, which drain the upper lateral quadrant of the arm, lymphatics from the upper part of the breast, especially the superolateral region, and some upper thoracic wall lymphatics. Now, efferent vessels emerging from the apical nodes merge to form the subclavian trunk, which is a large lymphatic channel at the base of the neck. So, the right subclavian trunk typically empties into the venous system at the junction of the right subclavian vein and the right internal jugular vein, whereas on the left side, it usually joins the thoracic duct and drains into the venous angle, which is the junction of the left subclavian and the left internal jugular vein. To quickly summarize, the axilla is a pyramidal gateway between the neck and the upper limb. It has four well-defined walls, an inlet, and a floor. The inlet is formed by the clavicle first rib as well as the superior border of the scapula up to the coracoid process. The anterior wall is formed by the pectoralis major, pectoralis minor, subclavis, and clavipectoral fascia. The medial wall is formed by the upper thoracic wall and the serratus anterior. Lateral wall, which is the narrowest wall, formed entirely by intertubercular sulcus of the humerus with its attachments. Posterior wall made up of subscapularis, teres major, latissimus dorsi, and long head of triceps, and the floor, which is made of skin, superficial fascia, and deep fascia forming the armpit. We've also discussed the contents of the axilla, which is the axillary vessels, the cords and branches of the brachial plexus, important lymph node groups, and parts of key muscles like coracobrachialis and short head of biceps brachii, along with the axillary tail of the mammary gland. If this helped you, don't forget to like the video, share it with your batchmates, and subscribe to the channel.